Hello guys, welcome all of you to today's PHARMCAST. And first of all, I would like to apologize. I could not record the PHARMCAST in last week because I was having quite a heavy schedule with respect to recordings, and I had some work at home as well, right? Because there are some family works you cannot deny at times, right? But nevertheless, guys, the good thing is we are back with the PHARMCAST for this week, and in today's PHARMCAST, guys, for this week I'll be covering one small topic which a student had asked me to cover in the PHARMCAST, and that is to cover all the phosphodiesterase inhibitors, right, in a nutshell. So I'll be covering all the phosphodiesterase inhibitors which we discuss across different topics in pharma, right? In CVS, in respiratory system, we discuss about different phosphodiesterase inhibitors, right? So I'll combine that all of those. Second, guys, a lot of you have asked me to speak about the the recent delay in the NEET PG exam. So I mean, what does this delay mean? And I'll tell you from the perspective of what I would have done, right, when I was a student, when I was preparing, and if I was in this situation, because I love to explain you guys, keeping myself in your position, so that gives more of a realistic approach as to what should be done. And at last, guys, obviously we'll be discussing your doubts, some specific doubts that you guys have commented in the YouTube channel. Right, guys, so let's begin with the phosphodiesterase inhibitors. And guys, see, the first thing you need to understand is what is the function of this enzyme phosphodiesterase in our body. So this enzyme is present in smooth muscles as well as your cardiac muscles. So major functions are because of smooth muscles, right? So what phosphodiesterase does in smooth muscle, it metabolizes cyclic AMP and cyclic GMP. So two secondary messengers are metabolized by phosphodiesterase in your smooth muscles, whereas in cardiac muscle, it metabolizes cyclic AMP. So just imagine what would happen if I block this function of phosphodiesterase. In smooth muscles, there would be an increase in cyclic AMP and cyclic GMP, and in your cardiac muscles, there would be an increase in cyclic AMP, right? So let us talk about smooth muscles. So whenever cyclic AMP increases in smooth muscles, as I've discussed in G Pharma, what it does is it phosphorylates MLCP, myosin light chain phosphorylase, and dephosphorylates MLCK, myosin light chain kinase. So end result is relaxation of smooth muscles. Whereas cyclic GMP also relaxes smooth muscles, but via different mechanism. What it does is cyclic GMP pathway, it increases release of nitric oxide. So primarily via nitric oxide pathway, it produces vasodilatation in the blood vessels, right? Whereas cyclic AMP pathway in your smooth muscles like bronchi, they will produce bronchodilation, blood vessel, they will produce vasodilatation. So overall, what you have to remember is whenever I block this enzyme phosphodiesterase in smooth muscles, the end result would be smooth muscle relaxation, like bronchodilation, vasodilatation, GIT relaxation. So anywhere, guys, there would be relaxation. But if in cardiac muscle I block this enzyme phosphodiesterase, what it would do is it would increase cyclic AMP, that would phosphorylate calcium channels and increase contraction, right? Increase contraction of the myocardium. So from this, what we can understand, phosphodiesterase in smooth muscles, relaxation, bronchodilation, vasodilatation, which means what? There is one common side effect I can understand. Whenever I block phosphodiesterase in smooth muscles, there would be vasodilatation, and these drugs, they can cause hypotension. So phosphodiesterase inhibitors, you should be careful while combining with other vasodilators like nitrates. Whereas phosphodiesterase inhibitors in cardiac muscles, they would increase calcium. So they're used in heart failure, but they have risk of arrhythmia. So phosphodiesterase inhibitors, specific one which is present in heart, like phosphodiesterase 3, that increases risk of arrhythmia. Now let me a little bit specify this. Like for example, we have non-specific phosphodiesterase inhibitor like theophylline, aminophylline, right? So these drugs, guys, they block both phosphodiesterase 3 and phosphodiesterase 4, right? To some extent, they block phosphodiesterase 5 as well. But the reason why we use them in pharma is because of block of phosphodiesterase 3 and phosphodiesterase 4. And the end result of block of these enzymes in bronchi would be bronchodilation. And thus theophylline or aminophylline, they're used in bronchial asthma and COPD. Now if they ask you, Bronchodilation is mainly because of which receptor? Is it phosphodiesterase 3 or phosphodiesterase 4? Your answer would be phosphodiesterase 3, guys. So phosphodiesterase 3 block mainly gives us bronchodilation. But remember, theophylline has anti-inflammatory effect as well. So if they ask you anti-inflammatory effect is because of which receptor specifically, your answer would be phosphodiesterase 4. So theophylline, bronchodilation, phosphodiesterase 3 more than phosphodiesterase 4 block, anti-inflammatory, phosphodiesterase 4 block. And as I said, whenever you block phosphodiesterase 3, for example, in the cardiac muscles, then in your heart, they can cause arrhythmia. So theophylline can cause arrhythmia, and one of the important reason is phosphodiesterase 3 block. And that is also because of adenosine receptor antagonism. So I'm not going to adenosine receptor because here our main focus is phosphodiesterase enzymes, right? Now moving on to another one like phosphodiesterase 4 inhibitor. Now I'm coming to specific inhibitors, right? Theophyllines, aminophylline, these are non-specific inhibitors. Specific inhibitor, phosphodiesterase 4 inhibitor, there is a drug called as roflumilast. So roflumilast, it is used in COPD, and how it is going to act, I told you, right? Phosphodiesterase 4 inhibitor will produce both bronchodilation as well as anti-inflammatory effect. That is why it is used in COPD, guys. Remember, it is not approved for bronchial asthma. Whereas in CVS, we have studied about phosphodiesterase 3 inhibitors. And phosphodiesterase 3, when I block, they're present in blood vessels as well as your heart. So what they do is they increase cyclic AMP. Phosphodiesterase 3 inhibitors increase cyclic AMP both in heart as well as blood vessels. In heart, they would increase contraction. In blood vessels, cyclic AMP, smooth muscle, will cause vasodilatation. So they produce inotropic effect as well as vasodilatation. That is why phosphodiesterase 3 inhibitor, they are called as inodilators, right? And the most important drug here is milrinone, which is used in acute heart failure, which is resistant to drugs like dopamine or dobutamine. And again, guys, I told you what could be the side effect. You don't need to mug up things. Just try to imagine the concept. When I block phosphodiesterase 3, it is going to increase calcium in the heart, and because of that calcium, it would cause arrhythmia. So phosphodiesterase 3 inhibitor like milrinone, there is a risk of arrhythmia. Whereas phosphodiesterase 5, it primarily metabolizes cyclic GMP. So when I block phosphodiesterase 5, it increases cyclic GMP in the blood vessels, and that produces vasodilatation, right, by your nitric oxide pathway, by which it increases cyclic GMP, that produces vasodilatation. And now remember, phosphodiesterase 5 inhibitors, guys. Phosphodiesterase 5 inhibitors, we have drugs like sildenafil and tadalafil. And these drugs, they will produce vasodilatation, and for which they are used in erectile dysfunction and pulmonary hypertension. And again, guys, whenever I use a phosphodiesterase 5 inhibitor in the blood vessel, the effect is vasodilatation. Means remember, vasodilatation will give us side effect, which is most important, is hypotension. And thus these drugs which cause hypotension among phosphodiesterase 5 blockers should be avoided with drugs which can cause significant hypotension like nitrates. Right, guys, so there is the section of phosphodiesterase inhibitors, which I want you guys to understand the basic concept of what happens in our body when you block phosphodiesterase. Now coming to the second aspect, guys, which we have to discuss today, there is a delay in the NEET PG exam. And what should I do? Now I'll divide the students into two halves, right? Number one, those students who have completed the syllabus, right? They are revising now, and the revision is going full on, they're on time, and they are about to reach the destination on time before the exam. And I think that these category of students, there are only few students who would belong to this group, right? And even if you speak about myself, even I don't belong to this group, because since I don't belong to this group, right, the second group, I would tell you from my perspective, what would I have done differently. So I belong to that second category of student who have some drawbacks in their preparation, right, which they feel that if they have time, they wish they had time, they could rectify it, right? So just imagine, guys, for those students who have some drawbacks, something, you know, which they would like to improve in their preparation, and now they have time for it. So you can do that. For example, let me take my example. Say I prepared good for 17 subjects, right? 17 subjects, I was confident enough that this is what I could do, and I could not have done anything more even if I had more time. But 2 subjects, my preparation, right, could have been derailed because of these 2 subjects. One is pediatrics. I have told you in my other PHARMCAST, I could not attend my pediatric class because I was ill for 15 days, a viral fever. and so pediatrics was gone. So I improvised on pediatrics. What I did is I only did the questions and answers, and back then, we didn't have online classes, so I had no way I could go and attend someone's classes and online, or even there was no pediatric specific guidebook was not there, and even if the guidebook was there, I did not have time. So every day I would practice half an hour to 1 hour pediatrics MCQ. So I improvised on pediatrics. Anatomy was second subject which I was very weak in, and even though I attended the class, somehow I never found myself comfortable around anatomy while solving MCQs questions. I ultimately forget it, and I thought that, and it was taking a lot of time for me to wrap up anatomy in my head. So for that also, what I did is I solved most of the questions, and I realized one thing with anatomy, that no matter how much you study, right? In our times it was like that. No matter how much you study anatomy, you'll not be able to solve few questions, right? And most questions which topics were repeated, you would be able to solve. So at my time, the exam pattern was a little bit different. We used to have a lot of repeats of topics and questions. So going forward, guys, suppose when I was giving my exam, and my AIPG or All India PG was not delayed, but if it would have been delayed, then what could I have done? I could have improvised on peds and anatomy. So pediatrics, what I would have done is, nowadays we have access to online lectures. I would have attended some online lecture, or I would have taken some guidebook or any source, and I would have tried to improve my pediatrics. And second, anatomy, guys, even I know now, I don't know what I would have done, but I would have done something at least, right? Attended some other class, or done something, or taken some notes to improve my anatomy. And how would I have done that? The question is most important. And how would I have planned is important. That is, see, I need a plan where I need to both revise and study. So guys, try to understand me. You cannot abandon your revision which is going on, right? So now suppose you are revising full throttle, 10 hours a day revision was going on. So what I would have done, I would have revised only 7 hours a day, and I would have kept 3 hours every day for these two subjects, anatomy and pediatrics, and I would have tried to cover them in a better way. So in that way, what I'm doing is I'm not jeopardizing my revision. I'm continuing my revision. Plus that extra time, whatever I'm getting here, I'm trying to invest that time to make these two subjects more productive. So that would have been kind of blessing for me, right, at that time, if I had this time. And so the aim, what was my aim? My aim would have been, in this extra time, is to make those two weaker subjects stronger. And guys, believe me, most of the students, they have at least 2 to 3 subjects which they are not strong in. So you have time by which you can make some changes. And meanwhile, continue giving your grand test, 1 to 2 grand tests. So now that you have more luxury of time, you can take 2 grand tests from 2 different platforms every month, guys. Now coming back to those first category of students who have done everything perfect until now, and they were eager, right, to get out of this frustration of exam preparation. And I understand, guys, you would be frustrated because you would have liked this period of your life to end sooner than later, and now it is getting delayed, and the frustration creeps into us. I can understand that. And I'll tell you from one thing, right? When I was preparing, I thought that post I give my AIPG exam, I will seriously prepare for the AIMS, mid-AIMS exam, right? Or PG exam. But believe me, after I was done with my NEET AIPG exam, I did not have the courage to go back to my notes and continue it for another 3-4 months. So it takes a lot of courage, it takes a lot of patience to continue that, isn't it? So which meant what I was also very eager that this should end as soon as possible. I should get a seat out of it and move on with my life, right, guys? But remember, guys, you cannot give up now, right? You can't let your guards down, and you should keep revising rigorously. Even if you have a feeling that you have done everything, then you need to begin another session of revision. So continue revision, and if the exam is not on time, then you can begin another session of revision, 2 revisions, let us say, right? And now that the exam is delayed, and if you're feeling a lot of fatigue, right? You can go a little bit low on yourself, take a break for 1 week, right? Go somewhere or relax, or study, but study lightly, just practice MCQs. So take few steps back now. And taking few steps back does not mean that you are giving up, right? This taking few steps back means you are giving yourself time to relax a bit so that you can, make a bigger impact after that 1 week. And so bounce back on the job after that 1 week of break. And in this 1 week, you can try to analyze how you need to go forward with your preparation. So guys, we all as human beings are different, and we need to have a plan for ourselves, right? I can just guide you. You can take inspiration from that and make a plan of your own. Right guys, now coming to the third aspect which I wanted to discuss today, your doubts, guys. So coming to the first doubt, it has been asked by Ibrahim Faraz. So Ibrahim Faraz is asking, so I'm stressed out, which is taking a toll on me. I'm also kind of hypochondriac at the moment. Don't think I can productively carry on with the revision. So should I book a consultation, or are there any stress relieving techniques to tackle the ongoing problem? See, Ibrahim Faraz, I'm gonna tell you something which is not conventional, and you might find it funny coming out from the mouth of a pharmacologist. You can try homeopathy. And it might sound paradoxical, but 6 months back, if somebody would have said me that homeopathy works, I would have laughed, right? Because for me, they were never more than sugar pills. And because being a pharmacologist, I always want to know the mechanism of action, which receptors the drug acts upon, and how does it produce effect. And until and unless I'm not convinced with that, right, I'm not even satisfied with my class. Forget about taking a drug for which I don't know the mechanism of action. But 6 months back, there was something that happened with my life, right? I diagnosed myself with because I was having a lot of fatigue, unknown fatigue, right? So I did some antibody tests, right? Antibody spectrum test, autoimmune antibody test, and I found out that I'm having anti-TPO antibodies, though my TSH was not very high. So I came to the conclusion that what I'm having is called as subclinical hypothyroidism, Hashimoto subclinical hypothyroidism. I started on levothyroxine. Now levothyroxine gave me some kind of improvement, but still my fatigue was not dying down, right? So I digged deep into what could be the cause of fatigue, and the cause of fatigue is continuous inflammation that is going on the thyroid gland. So then what comes as solution? The solution comes as I need to tone down the immune system. And how can I tone down the immune system? Either by taking steroids or immunosuppressants. But you think, is it an option? It is not an option, right? I cannot do that. Now that is when I felt frustrated. I mean, I know so much about this, why it is happening, but it's like I cannot help myself. So I went to a homeopathy doctor with despair because I could not help myself. And I sat down with her and I explained to her why am I having this fatigue and how homeopathy can help me. Now she gave me a rationale, right? I asked her the rationale. I want to know the rationale. And she explained me, and I was convinced with the way they target your immune system, and they don't suppress your immune system, but they try to misdirect it, giving it a different target so that it does not attack your own tissues. And it works wonder, guys. It works wonder. Even I was surprised. So I came to a conclusion that, see, everyone has a place in this world, even homeopathy or Ayurveda, allopathic. For example, I cannot use homeopathy to treat a patient of acute myocardial infarction, right? That is not possible. So that is where LMWH and abciximab, it comes in. But whenever I'm having a patient of autoimmune disorder, you cannot do a lot with autoimmune disorders because you cannot prescribe, steroids or your immunosuppressants for a very long period of time. So that is where I think this homeopathy thing is good. So Ibrahim, the reason why I told you this in detail so that you can have faith and you can try, and believe me, you should be getting good response. And because see, I always tell you something which I'm confident about. Otherwise, I would never tell you something which I've never tried or which I don't know about. Next one, guys, Nishant Tangadi is asking, sir, please guide us through a brief idea about how to approach to this changed schedule. Now, that is what I have already done, Nishant Tangadi. Purvali Ghosh is asking, sir, I had been studying quite well for the last 1 month so my studies has gone downhill for the past 2 weeks. I haven't been able to study anything. It feels like my mind is blocked. I am just reading nothing. is going in, and now I'm feeling anxious that this year will go waste. What to do? See, Purvali Ghosh, everyone goes through such a kind of stage in their preparation when they feel that they are doing nothing, right? And your productivity is going nowhere. And believe me, this period is transient. This period is transient. It is not that you'll have an entire month. So you'll have few days, couple of days, or 1 week of this period. So you need to break. You need to break this, chain of unproductiveness. So just take one day rest, right? Take 1 day, don't study anything, don't do anything, and do that 1 day whatever you like, right? Go, and if you're a foodie, go and visit some places, have some good food. If you are a movie fanatic, watch some 2 to 3 movies, whatever you like. So spend the day for yourself, and this will kind of like act as a DC shock, right? So shock yourself, at least with something you love to do, and you will see that from the next day onwards, your this preparation is going to improve. So, but for that you need to believe in yourself, right? Spay a day that is without anxiety. Subramanyam Arumugam is asking, sir, last study flow past 15 days, I didn't read anything for last 2 weeks due to family issues. Please guide me, start again seriously for NEET. See, Subramanyam Arumugam, I told you that these things, family problems, they can never go out. I have told you once in my previous PHARMCAST that when I was preparing, I was married, and my in-laws came to me during that preparation for around 1 week, and I had to chauffeur them around, show them places. And whenever I was moving around with them, I would always try to recall something which I have studied. No, I was frustrated, but you can never say no to your in-laws, right? That is the last thing you would like to do. But nevertheless, these things, they are part and parcel of a preparation, right? Nobody can have, an adequately perfect preparation where you have no troubles or no such things going on. If you have some kind, a perfect preparation, then you are lucky enough. But I have never been through that. You'll have illness, you'll have some family problems. But despite all of that, remember, all of you guys, you have this. You're not alone in the boat. All of you are in the same boat. So despite all of these, you have to bring the best out of yourself. So there will be problems, there will be obstacles, right? So you have to re-strategize yourself and bounce back to the job in hand. Devesh Patel is asking, sir, you told that weaker subject revision do bit by bit. I have 2 weak subject, micro and pharma. So I give 1.3 hours each, and now the main subject is being lazy. Because earlier I cover whole minor subject in 1.5 days, now it's taking 2 days or much more. So Devesh, now I think time is not a factor, because we have a lot of time now because the exam has been delayed. So take your own sweet time and prepare, and in this due process of time, make this weaker subject stronger. So time is not a trouble as of now. Abhik Saha is asking, sir, he's a second prof student, and he has gone through the videos of edition 4, and when edition 5 comes, do I need to rewatch? No, you do not need to rewatch edition 5 videos. And in pharma, at least I'll be providing a separate video through which you can update yourself automatically. Sir, can you please tell us, so Sai Prasad Oza is asking, can you please tell us which drugs are now available for COVID-19 and their mechanism of action? So I'll try to do a podcast on COVID-19 drugs as well. But Sai Prasad, you can in the meantime, you can go through a video I posted in my YouTube channel. The YouTube channel where you are listening to my podcast, just browse through my videos. You'll find a video on COVID-19 drugs. So I've covered all the drugs in this world in that video. Vivek Vasudevan is asking, sir, best book for clinical pharma for UG and PG general medicine students. So clinical pharmacology, you should try to do it in your UG days, and the best book I feel at your level would be Cadasang. Cadasang is more than enough. So guys, coming to a doubt that has been asked by Sunaina Sheikh, sir, I'm facing a lot of problem now. Initially my parents were very supportive of me, but recently they have become a bit skeptical of me that maybe I'm not good enough to crack the exams. And now my younger sisters are even criticizing me that you are doing so much sacrifice for you. Why are you not able to do well? No need to study, you are getting old and all this. They're pinpointing my previous failures. Sir, what should I tell them? It's putting a lot of mental pressure. I come from a non-medical middle class family. Please help me, sir. See, Sunaina, So as I always like to give you my life examples, and here also I'll tell you practically what happened with me when mine was not related to preparation though. Mine was related to picking up a branch. So when I picked pharmacology, so when I left medicine, surgery, my parents were adamant to pick up something clinical, either medicine, surgery or obs gynae, and I was getting all these seats. And I was adamant that no, I know what I want to do in my life, but it was very difficult to make my parents understand, Sunaina, precisely because even I belong to non-medical, even none of my relatives are from medical family, right? We don't have any doctors. So they were pretty much, hooked on to me that I would become the first practicing clinician from my family. So I could not sacrifice my life for, the pride of the family. I knew what I wanted to do. So they were worried. My parents were, worried, and they were also, angry on me. And practically, they did not talk to me for, 1 month and gradually they were, annoyed with me. But it took them some time to understand that I'm happy with whatever I'm doing. So once they realized that I'm happy with whatever I'm doing after 4 or 5 months, so they were okay with it. And now they are like, you have done you have done whatever you wanted to do, and we are really happy that you have chosen your path in life. So that is something your parents and relatives, they come to realize. So Sunaina, what I'd like to tell you, take these things, right? These criticism in life will come from your near and dear one more, right? And we are not usually worried about criticism from other people, because who are they? They do not matter to us. But when our own people, our own friends, they criticize us, this is something which I have learned in my life, to take this criticism as a challenge, right? You criticize me, it's fine. I'll not take it as a negative thing and I'll just lie down, right? I'll take it as a fuel. And prove to you, to my critics, that I'm better than what you think of me, right? So they will help you basically build yourself. And no matter who are they, your relatives and your friends or whoever they are. So take this as a fuel, guys. Take this as a fuel, Sunaina. Reorganize yourself, and your best answer would be by getting a good rank, right? So do not forget it. What is at stake for you, right? Once you realize that, you see that things will fall into place. Sweta is asking, sir, please do a video on MABs, monoclonal antibodies. Sweta, please do not worry about MABs, right? Do not worry about MABs. Do not spend too much time on MABs. Nevertheless, I'll do a live session in Mero hopefully soon with MABs as well. So you don't need to worry about that. We'll do that session on MAB as well. Right, guys. So this is what, guys, we had to discuss today in the PHARMCAST. And if you guys want me to discuss any particular topic, right, like this student asked me to discuss phosphodiesterase inhibitors today, so I discussed. So you guys can comment and let me know which topic you want me to discuss. But be logical while you're asking something, right? Do not ask me to cover entire antimicrobial drugs in PHARMCAST. I cannot do that, right? You'll be asking me to put the entire ocean in a bottle. That is not possible, right? So be reasonable in asking what you want me to discuss, and certainly, guys, I will choose one topic and I'll discuss. And if you have any kind of doubts regarding to your preparation and anything in your life, guys, if you have doubts, I am always available to you guys, and I will cover your doubts. And as I always insist, I am more of a friend of your guys than a teacher, right? I consider myself, right? So humanity is above all. I never believe in seniority and juniority, right? Even a senior or junior, right? Everyone is a human. So a human is a human. So I never believe in that concept which exists in India. In Western countries, it is more of formality, who is senior or junior. Everyone is equal, and that is what we should also practice in our country as well. So guys, I'm your friend, and I'm always available to whatever queries you have. So that's all, guys. Take care. Bye bye. This was Dr. Ranjan with you.